Our staff, I think, feel that they're on very firm footing. They know what the evidence is.
The tools in general give us a step-by-step and, I guess, rigorous way to look at the evidence.
So my advice would be just start. In 2007, we began a journey of evidence-informed decision-making as a whole organization. And in fact, we set it as a 10-year strategic priority for ourselves. We were finding prior to that time that we were using lots of research evidence in our decisions, but we weren't systematic about it at all. So we wanted to start to use evidence more systematically, more rigorously, and we set ourselves the goal of being really transparent about how we used it.
There's been a lot of work working with, I know, the National Collaborating Centre for Methods and Tools, and we've had Dr. Megan Ward leading an evidence-informed decision-making strategy here at Peel. So that's really changed the way we look at evidence and the way we make our program and policy decisions.
We just started really, really small because we didn't really know what to do or how to do it. So we started with assessing our organizational need. So we used Research Working for You, a tool that's on the Nccmt website. And we started with some workshops. It grew from there. The next thing was that we wanted to feel more confident about assessing quality of research. So we looked for places to go to get training, and there's online training modules in that. There are tools on the Nccmt website for that. So one of the tools that we found extremely helpful is a tool called the Applicability and Transferability tool. This is a tool that you use after you've done a review of research evidence and you want to apply it to your local context. When we have developed an evidence review and we've taken it through the applicability and transferability process, our staff, I think, feel that they're on very firm footing. They know what the evidence is. It allows them to have quite a bit of confidence in the decision that they've taken.
Tools in general give us a step-by-step and, I guess, rigorous way to look at the evidence. Instead of asking a research question and then going into all the evidence out there, so just say every single study that's available out there on a topic, we focus in on a very specific research question using the PICO format, which is, population intervention control outcome. And from there, we use tools like the evidence hierarchy, which allows us to focus on the most synthesized, high-quality research and move along in that sense. So it's very step-by-step, rigorous, and it allows for consistency among staff too, so that they're all looking at evidence in the same way. And we're always accountable and transparent in our decision-making process.
One of the most effective communication tools that we got from the Nccmt is a small diagram, and it looks like 5 colored bubbles overlapping. And it shows research in one of the bubbles, but it also shows political preferences, resources, community, and public health expertise in the other 4 bubbles. And I use it to communicate to our staff that although for our strategy in evidence-informed decision-making, we want to bring research to the table in our decisions, in fact, by far it's not the only thing we're going to bring to the table when we take a decision. And those other 4 areas are just as important. And depending on the program or the service, one or more of those factors may take precedence. And our staff always respond to that very favorably. So though it's a very simple diagram, it's quite reassuring to them that we're not missing things that they know to be important in public health decisions.
Even though the process and using these kinds of tools can seem daunting at first, with a little practice, they become easier to use and you actually start to rely on them, and you wouldn't want to go through doing a review of the literature without these types of tools.
When we began our strategy in 2008, we realized we didn't have a functional library. You can't use research evidence if you can't get a hold of it. We were able to do a review of library services. As a result of that, we were able to hire a reference librarian, and we were able to join a health services library consortium to actually get us access to articles that we needed.
We look for the most current evidence for our clients, and we're looking for synthesized evidence, which is different from what librarians traditionally do. Usually they're getting all the information on a topic. Synthesized literature takes single studies and puts them together so they don't have to read 100 studies to see what the best recommendation is or the best intervention is in public health.
It's a difficult time in public health in terms of funding, so we're always making choices about which service to deliver. And to do that, we really have to know what's going on in our population. Every health department will have to decide which services and programs to emphasize for their population and which ones will have to take a bit of a back burner just because of resources.
If individual public health practitioners do not have access to a library or a librarian, there are sources, key sources that they can use for synthesized evidence. Things such as NICE, things such as the CDC, Health Evidence, the World Health Organization. So a lot of these bodies will put out synthesized guidelines that will have to be appraised, but there are sources that they can use to get that information.
For those that don't have the same supports in place that we do here at Peel Public Health, I think there is a way to start off the process of evidence-informed decision-making when they're looking at program and policy decisions. They could look at the tools and resources available and, for example, potentially using the hierarchy of evidence tool as a way to guide the way that they look at evidence. If they're able to appraise it using a tool through Nccmt, then they're much better off than having used none of those.
Our staff feel, and they've said this to me many times, they feel like they're on a firm foundation if they've been systematic and rigorous, transparent in terms of finding evidence, quality appraising it, summarizing it, applying it to our context. People just are a lot more confident. So my advice would be just start. Just start with what you have. We had so little money to do anything that I looked for a lot of things that were very low cost, and it turned out lots of them were free of charge too. They're available over the internet, and so we just began with those. And as we could find some money to do some other things, we just added things on, and we just try and stay very curious about what seems to be working for us as an organization in using research evidence and what doesn't, and we discard what doesn't work and we carry on with what does.